Emily, AGI partners with African government ministries to help them advance their goals. Obviously, that became a much more urgent and different task when the Ebola outbreak happened. Help us understand sort of the institutional arrangement here.
So we'd been working in Sierra Leone with President Koroma since 2008. We have a team of people like myself who work side by side with government leaders and ministers to help deliver on the president's agenda and the top priorities. That changed significantly in 2014. The only priority for Sierra Leone was Ebola. So we started identifying areas where we thought we could come in and help them build systems. The first two that we identified were helping them set up a national call center to handle all of the alerts that were coming in, that the public could call in and either report that someone was sick or also ask questions. And the second was to support their decentralized response in the Freetown area, which is the district of Western area. And so to work with the district health medical team to think about the structures, the systems it needed to respond to an increasing number of cases and alerts that were coming in Freetown.
Right, okay. So in a lot of ways, I think what we've heard about the Ebola outbreak was that it was, in as much as it was a public health emergency, it was sort of a logistical emergency. And it sounds like those are some of the capabilities that you were working on delivering. Obi, help us understand what your office was tasked with and how did you coordinate with AGI?
Yes, so the National Ebola Response Center was set up at the end of October because the government needed an entity that could focus solely on Ebola, which would free up the Ministry of Health and Sanitation to address the other healthcare issues that we had in the country. I was the director of the Situation Room there. If you, and we did, imagine our battle against Ebola to be a war for the very existence of our country, then there's always the war room where the generals get to sit down and see just what the battlefield looks like, and based on that intelligence decide how to deploy their men and their material. And so to that extent, that's precisely what my Situation Room offered, that capability.
So what was this intelligence landscape? What did it look like when the Ebola outbreak first started? Take us back to those early days and the challenges that you faced.
So we as AGI really started working with the government on Ebola in August of 2014. It really picked up in Freetown in September of 2014. And at this time, there really was no data. It was very difficult to understand not only what was happening with the disease, where it was hitting, but also what was happening with partners. At this point, there were a number of partners coming in, but there was no central source of information. One of the things we worked on was the call center, and this was one of the first times we started to see data or could analyze what was happening. Once we set up a call center structure, we could look at how many calls were coming in from what district, how many of these calls were about dead bodies, or how many of these calls were about sick people who were suspect. And we were able to start using that data to analyze. But what was a challenge for the government at this period was that different organizations had different pieces of information, but no one was helping bring everything together to coordinate a whole response. And this is where the move from September to October of 2014, the establishment of the National Ebola Response Center, and this idea behind setting up a Situation Room really came into play.